Okay, folks, so how many of you out there enjoy going to the dentist? Anyone? Anyone at all? Well, hello again, folks, and welcome back to another Dentistry Made Simple video. My name is Dr. Kenneth Goods, and I'm a retired dentist from the state of South Carolina here in the U.S. In today's video, I want to discuss the very important and very real subject of the fear of going to the dentist that so many people struggle with. Why people have that emotion, and what you and the dental team can do to help alleviate at least some of this fear. So for starters, I think it would be helpful to differentiate between dental anxiety and dental phobia. Studies indicate that only 10% of U.S. adults have dental phobia, but as many as 75% of us have some form of dental anxiety about going to the dentist. Now, dental anxiety will usually take the form of an elevated heartbeat or sweaty palms or a general feeling that you wish you could be going somewhere else, but you get through it. On the other hand, dental phobia is an entirely different problem. Here, the fear is so strong that the individual just can't make it to the dentist unless their pain is too much for them to handle. And this simply causes the problem to snowball because minor dental problems that could be treated easily get ignored, the situation gets worse, they become more embarrassed about their teeth, and they withdraw from family and friends, and so forth and so on as the cycle keeps repeating. These individuals can actually get physically ill, they can suffer from insomnia, or even sink into dread and extreme nervousness in the days leading up to their dental visit. And more often than not, they'll likely cancel the appointment simply to get relief from these symptoms. Now let's talk about what can trigger these anxieties and phobias. In no particular order, here are several possibilities. Number one is the fear of pain. This fear often stems from a previous dental experience that was unpleasant or painful, even going back as far as their childhood, or from horror stories told to them by others about their dental experience. Number two is the fear of getting the injection. Listen, folks, it's a needle in your mouth. I get it. In fact, a colleague of mine, a dentist, couldn't take the shot. So it can affect anyone. Furthermore, we can have questions such as, what if the numbness doesn't take or doesn't last? Or I wasn't given enough? Will I have a bad reaction to the anesthesia? Or I really hate that fat lip feeling. These questions can really mess with your imagination and take you to a bad place. Number three is the invasion of your personal space. There's a closeness that can't be avoided when performing dentistry. And this can trigger feelings of claustrophobia or the feeling that one can't get enough air. In addition, the patient might be embarrassed about the condition of their teeth or any mouth odors they may be emitting in such close quarters. Number four is a feeling that you are helpless and have lost control. You're leaning all the way back, your mouth is wide open, and you can't see what's going on. That is not a position of strength, and that makes plenty of people uneasy. Number five, maybe the sounds and smells of a dental office make you nervous as soon as you enter. And number six, and don't laugh, folks, but Hollywood isn't helping the situation any either. We can all remember movies such as Marathon Man or Little Shop of Horrors, amongst many others, where the dentist is either portrayed as a sadistic villain or a bumbling fool. If you're already hesitant and fearful because of the examples I mentioned earlier, then these stereotypes are doing absolutely nothing to put you at ease. So let's finish up this video with some ways you and the dental team can help alleviate some of these fears as much as possible, with the understanding that some things can't be changed. The key to coping with fears and anxiety of going to the dentist is to discuss your fears with your dentist first. Once your dentist is aware that you are battling these emotions, they can usually work with you to help alleviate these fears and hopefully make you more comfortable. Now, this reminds me of a story from my days of practicing. I had a woman in for a routine filling a few years back, and as soon as I began giving her the injection, she immediately went unconscious. Well, needless to say, I became very panicked as I assumed she was having a very serious and potentially life-threatening reaction to the anesthetic. I had my receptionist call 911 and I immediately started her on oxygen. About the time the paramedics arrived, the patient started coming to, and after she came around fully, she turned to me and said that she often faints when getting her shot. Had she simply told me that before we began, perhaps we could have taken steps to keep her more calm, or at least given me a heads up that she faints, rather than having me thinking she was going into a medical crisis. So please communicate any fears that you may be having with your dentist or hygienist. Let them know up front and be honest. It really helps. If lack of control is a hot button issue for you, then again, inform your dentist. Ask your dentist to explain each step of the procedure so you can mentally prepare for what's coming. I often had a little hand clicker taken from a board game that I would hand to the patient. If they began to feel anything or needed to spit or just needed me to stop for a second, they would sound that clicker and everything stopped. This was a great way to give control back to a fearful patient. Although this isn't for everyone, sedation may help you with your anxieties. Some people are given an oral sedative for the night before their appointment so they can sleep, and another about an hour before your actual appointment time, and you would need someone to drive you to and from your appointment, obviously. Other forms of sedation include nitrous oxide, laughing gas, or even IV sedation, but that's typically reserved for longer appointments. Perhaps being able to schedule your appointment after hours might enable you to avoid the smells and sounds of a typical busy dental office. I knew plenty of dental offices that baked chocolate chip cookies in their kitchen just for this purpose, to help overcome the smells often found in a dental office. And it did make for a tasty reward after your visit. And lastly, and this one hurts me to say, but if your dental team is not showing you the compassion that you require, then perhaps you might need to find a new dental home. The entire dental team should be asking you how you are feeling about the dental treatment when in the chair. They should have some kind of stop signal that I referenced earlier. They should know you on a more personal level. They should address any fears or embarrassments you may have. And let me just say that we dentists have seen it all, so there is no need to be embarrassed. And lastly, your needs should come first. Folks, dentistry is stressful enough for the dentist. So anything I could do to keep my patient calm and not squirming or fidgeting while I was working was well worth it. Also, I am happy to report that dental schools are now including training for their dental students on how to address and treat anxious patients to help put them at ease. And that is great news. Well, let's wrap up today's video, folks. I hope you learned something that you didn't know before. If you enjoyed this video, would you do me the favor of hitting that like button below, as it will help this channel grow? Feel free to leave a comment or question as well. Please consider subscribing and be sure to hit that bell icon so you can be notified of future videos on dentistry made simple. Bye-bye.